All right, next up in our core and knee stability series is a high plank with alternating hip extensions. Now, I really like this one because it helps restore stability of both the anterior core, but also those quadriceps muscles in cases of a knee injury or surgery. So to perform this, we're going to go in what's called the high plank position. So we need a table or countertop, something that's not going to move. I'm going to go into what we call the high plank position, which is my arms are straight and I'm backing my legs out until I am in a nice straight line, nice good spinal alignment. I'm not sagging my hips or tenting. Find that neutral. So once in position, what I'm going to do is I'm going to lift one leg, little pause back down, in the other. Now throughout this exercise, I really want to monitor two main areas. I want to monitor for my core engagement. I'm still breathing nice comfortably, but I'm keeping a low level contraction here. But I'm also keeping my quadriceps engaged. So when I lift up my right leg, all of the load goes through my left leg and my knee is going to want to bend, right? So we don't want that to happen because that's a loss of quadriceps control. So when I lift this leg up, I'm really squeezing this quadricep as tight as I possibly can, come back down and then switch. So it's really good to restore stability of both the anterior core and the knee. Nice controlled lowers, lift, a little pause, and then back down.